Hello, everyone. And first of all, I would like to thank our patient. So we won't be saying her name for privacy reasons, but thank you for agreeing to share your story with us. And so she's traveled all the way from Africa to get her varicose veins treated, and it would be great for us to know her story as to what she was suffering from and all such things. So welcome and thank you for sharing. So can you please let our people know what you were, what you were suffering from?
Sure. So basically, I was suffering from varicose veins, I believe. And there was a lot of pain in my legs. Initially, when I came, just a few days before I came, I had severe pain in my legs. Now, this pain or varicose veins has been continuous for, I can even say, what, 15, 16, even 17 years or even longer. I obviously developed it moreover after the birth of my children. I'm not sure whether it's hereditary or it's something that just comes depending on a person, but obviously I had it. So I initially I wasn't so concerned about it. I was taking it very lightly till a very close family member got ill with the same, and we lost them last year. So yeah, then the concern became a bit more apparent, especially to my family as well as myself. I wasn't still very concerned, but a couple of days before I flew out, I think on the 4th or the 5th, I can't actually remember, but no, actually earlier on in Jan, I actually had severe pain in my legs, and I developed a sort of a white boil. And my concerns started growing because, I was scared that I was starting to ulcerate. We went to the hospital in Malawi, and the radiologist just point blankly said to me, "You need ablation," which means removal of or extracting or whatever to the vein, something to help with the ulceration and to reduce the size of the veins. So my children started researching online, and we picked up the vein center. That's where it all started.
Yeah. So nice. I mean, great to know that you found us online. Uh, so, uh, so this, we noticed that you had that, dark discoloration on the legs.
Sure.
So, was it there for quite some time?
Yes.
Or was it like a recent development?
It was there for a while. And I did try homeopathy medication, which reduced the swelling. I also had developed a lot of swelling in my legs and ankles and my feet. It reduced the sort of swelling, but the redness never went.
Yeah.
The redness just sort of it's
kept getting darker.
Yeah, and was darker. And you would think that it's going nearly now to a blackish red to that extreme extent.
Okay. So also, just for our people to know, the redness is actually a kind of bleeding underneath the skin, and as hemoglobin keeps getting accumulated, that gives the dark pigmentation. So the discoloration is not just a skin disease; it's bleeding from the large veins that gets deposited, progressively damages the skin, and it's one step before the wound happens. So. And since you traveled from abroad, and my team was coordinating you from before, would you let our the people who are viewing know a little bit of the logistics? So I remember we had a video consultation before you flew out,
Correct.
right? And so where we discussed your issues, and I remember the ultrasound report was just a single line thing. So I mean, yes, and I told you that we need to do a scan again, and you flew down, and we could confirm it. And all this while on the back end, our team was coordinating with your international insurance company as well.
So we're affiliated to Medilife, primarily called April, and they're an insurance company they're affiliated to Medilife, which is UK based, but we are from Africa. And so we're using April, and they were able to work with your team and get paperwork done, and your team was very efficient, and they were able to supply them with everything that was required, which then helped me to get my procedure done in less than 2 days of being here. So that was really amazing. And because of your efficiency and because obviously you were able to, because the main thing with any insurance is that they need the correct information.
Yeah.
If you supply the correct information, then I'm sure it becomes really easy. It was actually a very easy ride with regards to the process of getting insurance. And my insurance, seeing the fact that the way the explanation was given, I didn't have to pay anything. My insurance covered it.
No, that was really amazing.
Yes,
We were also quite surprised as your insurance company was really efficient in just settling the bills and the amounts without too much back and forth communication, and it happened seamlessly. And I'm really glad that you could travel all the way and have your insurance company take care of the billing part of things, and that would make someone with similar insurance make it a quite very peaceful and easy to just to come and treat.
Yes. Because I think now with India going so well and being so advanced, I think I personally feel that a lot of the insurance companies have a lot of faith in India. So when you say you're flying out to Mumbai, it's not so questionable as it would be anywhere else. Because I think that you can facilitate, and I think they know you can facilitate for all the issues that people have, or medical issues that patients have.
Great, and would you also let so you've had the Veena Seal procedure for your varicose veins. So I wouldn't want to put words in your mouth. Would you describe how it felt when we were actually doing it?
Sure. So it was actually not as discomforting. Obviously, in any operation, we're always scared. Any patient is sort of, apprehensive and sort of always worked up. But it was such a relaxed atmosphere. I even had music. So it was a very relaxed atmosphere. And at the pain, of course, you feel a little bit of a prick, but other than that, I didn't really feel any severe pain. Obviously, where I had the ulcer, there was a little bit of discomfort, and the anesthetist was really on point, and she made sure that she kept me quite calm, and she gave me what I needed when I needed it. But it all worked well. I mean, I was quite overjoyed, and when I told my family the story that I walked into the theater and I walked out of the theater, they were like, "What?" Because
and you go back to the hotel room in the afternoon, right?
It was amazing because they were like, "What? How did that happen?" So I myself was quite overjoyed to be able to walk in and walk out. That was fantastic.
Great. So you remember we clicked pictures before the procedure, and then we clicked them again 5-6 days later. So what do you feel after seeing? Although 5-6 days is a little bit less to judge, but still, what are your impressions about your before and now?
I see a big difference. I actually haven't even mentioned to you, but I feel that the day we did the operation and I wore my stockings, the compression felt much tighter. And now it doesn't feel as tight with the compression stockings. They actually feel very comfortable, which means that obviously the swelling is reducing much more than it was. I usually hate wearing compression stockings. I actually feel comfortable wearing them after the procedure, which means that my legs aren't in pain anymore, which is amazing. The look of the legs seems much cleaner. It doesn't seem as blue, because I used to tend to have a lot of blue patches everywhere. So it seems much cleaner. It's almost like new legs. It's getting there.
It is getting there, and feels it feels very satisfying to be able to to see your results, and very good to hear your words. It usually takes around 2 months for the whole recovery process to complete. So we'll be clicking pictures regularly and seeing the difference. And finally, if you are if you had any message to give a prospective patient, or who's trying to decide whether he should travel or not, or he or she should deciding to make up their mind, what would you have to convey?
Okay, I'd like to tell all the viewers who are concerned for their legs or for their health and well-being to actually make an effort and to
Mhm.
travel out and come to the Vein Center
Mhm.
and meet with Dr. Saurabh,
Mhm.
because I feel for me it's a life change.
Mhm.
And I think for all of you out there who are suffering with the same, it would be life changing. We always worry about pain and discomfort. I mean, and this is one of the ways, and that to believe you me, this process is so uninvasive. There's literally no scars as such that I can mark on my legs, and there's no cutting. So it's so non-invasive that you feel so confident in doing it. I actually have done it without any family around, besides my dad, who is ill, and he also can't really look after me. So if I could do it on my own, I'm sure whoever has this condition should come out and come and do this Veena Seal. It is actually really life changing.
Thank you so much for your inputs, and really glad we could help. And hope you keep getting better. And hopefully, we'll see you again in a year's time for your follow up. Thank you so much. It was a pleasure.
Thank you.
Thank you.